Hi, I'm Tyler Duncan, one of the orthopedic surgeons here at Watauga Orthopedics. I want to talk to you a little bit about meniscus injuries. Meniscus injuries are one of the most common causes of knee pain that I see on a daily basis. The meniscus is a ring-type structure on the inside of your knee that helps as a shock absorber. You have one on the inside and the outside of the knee. Typically, but not always, meniscus tears are associated with a sudden twisting injury that results in sharp stabbing pain and swelling about the knee. They're very common in both young athletes and as we get a little older. I typically see pain along the joint line on either the inside or the outside of the knee, and it's very commonly associated with swelling around the knee. Some people describe sharp stabbing pain around the knee as they go around a corner or have a sudden stop. And it's also associated with locking, popping, and catching. I typically diagnose meniscus tears starting with physical exam and x-rays to rule out an associated fracture. If we have a high suspicion that you have a meniscus tear, we may need to get further imaging like an MRI to confirm our suspicion. There are several treatment options for meniscus tears, both operative and non-operative. Commonly, we begin with rest, ice, and anti-inflammatories. For many people, this is all they need. For some, a corticosteroid injection into the knee can provide quick and significant relief. Unfortunately, some people will require an operation. This is typically done doing something called an arthroscopy, where we use small cameras and instruments to go inside the knee and fix the problem. In some instances, we can repair the tears, but most commonly, we just need to trim up the torn area. This leads to significant and almost immediate resolution of many of the symptoms.